Okay, Spencer, so now that we did the extra oral exam, I'm gonna follow that with the intraoral exam, okay? Please let me know if anything is tender as I do this or if you're feeling discomfort. And I have all my proper PPE on, my eyewear, my mask, my gloves, my gown, button to my neck, and my hair is up. And I had Spencer already rinse with the antimicrobial mouth rinse for 30 seconds. He's laying in the supine position. I'm gonna pretend to put his goggles on. I've already done all my infection control before he even was here in the chair. And I think we are ready to get started. So I'm gonna use this just to point out, my cotton tip applicator, just to point out where the structures are on your in your mouth. Is that okay?
Yeah.
Okay, perfect. Okay, so we're gonna start. So we got the lips, and then around the lips, that line is called the vermilion border. We have the philtrum. We have the labial commissures. As we open the lips, we're gonna have the labial mucosa on the upper and the lower. And then we are gonna have the deepest part of the tissues right in here. The deepest part where you can feel is called the vestibules. Up here he has the labial frenum, and right here where it's a little darker red up in here is called the alveolar mucosa, and then the firmer attached part is called the attached gingiva. The line that runs between those is called the mucogingival junction. The V shape in between the teeth is called the interdental papilla. Open big for me. Behind 8 and 9, the centrals, you're gonna have the incisive papilla. And then as you open his cheek here, that's called the buccal mucosa. The line that runs along the buccal mucosa is called the linea alba. And also some patients have little spots here that are called Fordyce spots. And so again, you have bilateral linea alba, so another line there. Then we're gonna move on to the parotid papilla, which in the parotid papilla you're gonna have the Stenson's duct. I'm gonna take a dry end of my cotton tip. I'm gonna dry it off, and then with my mouth mirror, pretend we're gonna milk the parotid gland, and that's when you're gonna see that they have good salivary flow, which he does. And then I'm gonna examine the maxillary tuberosities, which are behind the maxillary third molars, distal to the maxillary molars, and then the retromolar pad that's distal to the lower molar molars, mandibular molars. And then I'm going to look at all the gingival tissue. Make sure it's not abnormal, there's no bumps or like different colors or any sort of ulceration in the gingiva, and that it's like a nice healthy light pink color, and there's not like red rings around it or anything. I just want to make a note of all that. I also am going to feel his buccal mucosa and make sure that there's no lumps or bumps, anything hard, abnormal. I'll palpate the lips. I'm gonna palpate the vestibules and make sure there's nothing like hard or swollen anywhere, no lumps. And then I'm gonna have him stick out his tongue. I'm gonna palpate the tongue just to make sure there's also no hard spots or anything abnormal on the tongue. And this is the dorsal surface, and then this is the ventral surface of the tongue. And then on the floor of the mouth, I'm gonna place my index finger to palpate, and then I take my other finger on the chin, under the chin, and I'm gonna like meet those together so I can make sure there's nothing like weird or abnormal there. And then I'm gonna run my finger along the alveolar ridge of both the maxillary and mandibular arch. And then I'm gonna check the hard palate. So the line that runs this way on the palate, along the palate is the palatine raphe, and then these like hard ridges, I guess, are called the palatine rugae. And I'm just gonna check and fill those. I'm gonna use the mouth mirror and for vision and see the oral pharynx. And go ahead and swallow for me. Let's just make sure that is normal. Perfect. And he has really good salivary flow. And then I'm also gonna check the papilla. So stick your tongue out. So this is gonna be the filiform on the very end. This would be the apex of the tongue, and then it's gonna have the fungiform. And then the C-shaped papilla is the circumvallate. On the sides of the tongue in the back are the lingual tonsils. And then he's gonna have the palatine tonsils in the back of his throat, and then the anterior and posterior fascial pillars, anterior in the front, posterior in the back, and then stick your and then obviously the soft palate's right behind the hard palate. Stick your tongue way out. And then I don't know if you can see, but he has the uvula back there. It's like the punching bag. And then we're just gonna evaluate the mobility of the tongue. Like, is it moving correctly? Can you move your tongue side to side? Just make sure that's normal. Perfect. That seems like it's moving good. I'm gonna examine the lateral surface of your tongue with my gauze. So stick your tongue out, because this is the most common area for oral cancer. So we'll check that. Perfect, good. And then stick your tongue up. And then these are the lingual veins. Stick your tongue up and just keep it still. These are the lingual veins, and then we have the lingual frenum. We have the sublingual caruncle, which is the Wharton's duct. And then underneath the tongue, we just want to make sure there's no abnormalities or anything like that. And then right along the tongue, these little teeny things that kind of poke off, kind of on the lingual veins, is the plica fimbriata. And then the submandibular and sublingual ducts. And then these are the folds down here. And then we just want to record any abnormalities we saw, like morphology, surface texture, consistency, size, and any symptoms he's having. And I'm going to document in his chart or computerized records all the findings.